Do you notice dark patches on your forehead that just don't seem to fade away? You're not alone. Forehead pigmentation is one of the most common skin issues we see. Hi, I'm Dr. Jyoti Gupta, consultant dermatologist from New Delhi, and today I'll be talking everything about forehead pigmentation. The first and the biggest culprit is sun exposure. Too much sun doesn't just darken the skin, it causes tanning, wrinkles, that rough sandpaper-like texture, and over time this creates a cycle. The more sun you are exposed to, the darker and more stubborn the pigmentation becomes. Another very common cause is melasma. This is strongly related to hormones. Melasma usually can show up as a brown, bluish, and mixed patches on the forehead and on your cheeks, and can be triggered by pregnancy, stress, oral contraceptives, or even just regular sunlight. But pigmentation isn't always about the sun or hormones. Sometimes underlying health conditions may play a big role. For example, thyroid issues, Addison disease can both make the skin darker, especially around the eyes and the mouth also, including the forehead. Similarly, people with insulin resistance may develop a condition called acanthosis nigricans, where the skin on the folds like neck, underarms, and sometimes the forehead becomes velvety and dark. This also comes along with the skin tags. Medication can also be a hidden trigger. Drugs like antipsychotics, certain antibiotics for acne such as minocycline, malaria medication, and even painkillers may lead to pigmentation over time. Then there are a group of conditions which are known as autoimmune conditions, lichen planus pigmentosus, which causes rapid bluish pigmentation on sun-exposed area. Interestingly, this can sometimes be set off by things like mustard oil application on hair dyes, or fragrances. And of course, local factors matter too. If you have oily skin, you will notice pigmentation around the corners of the nose, mouth due to seborrheic melanosis. Constant rubbing of the forehead can also cause frictional melanosis, and harsh scrubbing with loofahs can trigger a condition called macular amyloidosis. In this condition, protein deposits make the pigmentation even more resistant to treatment. So, how do we deal with this? The first step is always lifestyle. We need to check for nutritional deficiencies, hormonal problems, insulin resistance, because unless these are corrected, pigmentation will keep coming back. If you are overweight, improving diet and exercise helps insulin resistance, which in turn helps your skin. If you are taking a medication that might be causing the pigmentation, talk to your doctor about the alternatives. And no matter what, sunscreen is non-negotiable. Daily protection prevents the cycle of tanning and darkening. We also ask patients to control oiliness of the scalp and the face, and dandruff control. Avoid harsh scrubs, stop rubbing the forehead, and stay away from triggers like hair colors, fragrances, and mustard oil. Once the basics are in place, we move to treatment. Topical creams combined with sunscreen are usually the first-line treatment. These help improve skin turnover and stimulate collagen production also, which gradually clears the pigmentation. For faster result, we add in-clinic procedures like glycolic, lactic acid, or salicylic peel, as well as carbon laser peels and laser toning. Skin booster with hyaluronic acid are another great option. They improve hydration and reduce pigmentation. In some cases, we even use Botox, not for wrinkles, but to calm the inflammation that worsens the pigmentation. For more resistant cases, treatment like injectable tranexamic acid, PGRN, or polynucleotides from salmon DNA, retinol, and TCA can help. We also use microneedling, CO2 laser, and advanced lasers such as Red Touch, TX, or Nd:YAG lasers, but these must be done carefully because if the treatment is too aggressive, it can actually make the pigmentation worse. So the takeaway is this: pigmentation on the forehead is never just one problem with one solution. It can be caused by sun, hormones, health condition, medication, or even lifestyle habits. That's why correct diagnosis is the most important step. Once we know the cause, treatment becomes straightforward with lifestyle changes, topical care, peels, boosters, or advanced lasers, depending on what your skin needs. And remember, patience is the key. Pigmentation doesn't clear overnight, but with the right approach, it absolutely improves.